Parkinson's disease, etiology, symptoms, advances, and future treatments. Parkinson's disease affects over 1 million Americans, with 60,000 new cases reported every year. Age increases the likelihood of the disease. However, approximately 4% of patients are under the age of 50. The disease is thought to be caused by a degeneration of the pigmented dopaminergic neurons found in the substantia nigra, but the exact cause is still unknown. Etiology. Parkinson's disease has long been thought to evolve from two main influences. Environmental influences include infection, intoxication, or trauma, and genetic influences. Environmental influences can result from toxin exposure from our water, industrial chemicals, farming, and rural environment factors, exposure to pesticides and herbicides. Exogenous toxins may play a role in the development of Parkinson's disease as well. Exposure to trace minerals, cyanide, lacquer, thinner, organic solvents, carbon monoxide, and carbon disulfide. The endogenous toxins of tetrahydroisoquinolines and beta-carbolines may play a role as well. In recent years, the environmental influences have been challenged. It has been discovered that toxins weren't specifically found in the brain of a Parkinson's disease patient. This has challenged the thinking of many scholars who believed that the environmental factors were an influence on the development of Parkinson's disease. This image is the area of the brain that is affected by Parkinson's disease. Most notably, you can see the very small area of the substantia nigra. According to Olenau and Teton, in their study on cell death in Parkinson's disease, the following information about genetic influences has been revealed. Approximately 5 to 10% of Parkinson's patients have a familial form. There is an autosomal dominant pattern of inheritance. Long family trees have shown where several generations have had Parkinson's. And in their research, they found a study by N. Wood in 1998 called Genetic Risk Factors in Parkinson's Disease. It was found that the familial genetic link was stronger than the age-matched control groups. The VA twin study was a study of monozygotic and dizygotic twins. The study revealed no difference between the two sets of twins in developing Parkinson's after age 60. However, when younger than 50, there was a markedly increased incidence in the monozygotic twins to develop Parkinson's disease, suggesting strong genetic influence in younger Parkinson patients. Mitochondrial complex 1. Mitochondrial DNA is a circular, double-stranded molecule, easily mutated. Mitochondrial mutation found in a defect of mitochondrial complex 1 can be maternally transmitted, but no specific maternal inheritance found, is not a determining factor as normal mitochondria was identified in Parkinson's disease. Having the mitochondrial DNA involvement is not strictly familial, as some with the defect had no positive family history. Lewy bodies are circular masses that push over other cell components. They are found within the brainstem or within the cortex. Eosinophilic cytoplasmic inclusion consisting of a dense core surrounded by a halo of 10 nanometers wide radiating fibrils, the primary structural component of which is alpha-synuclein. Although mutations of the gene are a rare cause of Parkinson's disease, alpha-synuclein is abundant in neurons, specifically in presynaptic terminals, and is a major component of Lewy bodies. This is a Lewy body dementia slide. Signs and symptoms. According to the National Institute on Aging, there are 4 main symptoms associated with Parkinson's disease. Tremor of the hands, arms, legs, jaw, or head is usually the first sign. Stiffness or rigidity, slowness of movement, impaired balance and coordination leading to falls. Other very common symptoms include low, mumbling speech and infrequent eye blinking. Additional symptoms may include depression or emotional changes, difficulty swallowing, chewing, and speaking, urinary problems or constipation, skin problems, and sleep disruptions. How a diagnosis is made. No exact test can determine the diagnosis. A neurologist will determine the diagnosis based on physical observation, exam, and medical history. A SPECT scan, called a dopamine transporter or DAT scan, can help but is not the only determinant. MRI, CAT scan, and PET scans will rule out other diseases for supporting the Parkinson's diagnosis. Occasionally, blood work can help diagnose. Interestingly enough, by the time a diagnosis is made, 75 to 80% of the neurons have died before any symptoms of the disease become apparent. Current treatments. There is no known cure for Parkinson's at this time. First priority is slowing the progression of the disease and decreasing the symptom severity. Increasing the dopamine in the central nervous system through medications. Antidepressant therapy helps alleviate associated depression, and some surgical treatments aimed at decreasing the motor symptoms. Levodopa, the medication of choice in treating Parkinson's disease, crosses the blood-brain barrier pathway, converted to dopamine in both the central nervous system and periphery, should be taken with carbidopa to control the amount of levodopa conversion to dopamine in the periphery. Usually administered orally with meals, must be dissolved entirely on the tongue before swallowing. Future treatments. Magnetic resonance or MR guided focused ultrasound technology. This is deep stereotactic thermal ablation with incredible accuracy. New drug therapies are emerging that will provide neuroprotection, ischemia laser treatments, and stem cell transplants. Prognosis without treatment. If left untreated, statistics show that patients will advance through the stages quickly. They won't necessarily die from Parkinson's, however, they die from the effects of the disease. For example, lack of muscle control while swallowing will cause aspiration, lack of coordination can cause a fatal fall, or complications from pneumonia. Prognosis with treatment. Using the levodopa medication treatment, there has been a significant increase to the patient's lifespan. While Parkinson patients have a higher incidence of death, it is prolonged with proper therapies. Improved quality of life with therapies and improved diagnosis techniques have helped to diagnose the disease sooner, resulting